Don't tell me he got disconnected. No, he's here. Okay, so if you've read and understood, considering it's surgical and augmentation, please tell me what exactly are you looking at?
Yes, ma'am. It is the cadaveric image of the cubital fossa.
Right, please tell me the boundaries of cubital fossa.
Okay, it is bounded medially by the lateral border of the pronator teres, laterally by the medial border of the brachioradialis, above by imaginary line connected to epicondyle, and the rope is formed by skin, subcutaneous tissue, superficial fascia, and deep fascia, and floor by the supinator and brachialis.
Please tell me the contents of cubital fossa from
Okay,
medial to lateral.
okay. From medial to
This
lateral,
is
it's
medial
the
and this is lateral. Yes.
median nerve, brachial artery, and the tendon of biceps brachii.
Okay, now I want you to tell me more. Wait, more questions? Yes. Right. If you would be able to kindly identify the structures from A to H.
Okay, ma'am. A is the median nerve, B is the pronator teres, C is the ulnar artery, E is the brachial artery, F is the
D.
biceps tendon, uh,
D.
G, D is
D.
the cephalic vein,
Okay. And G.
G brachioradialis,
Please tell me the origin, insertion, action, and innervation of the muscle G.
brachioradialis.
Yes, origin, insertion, please. Origin and insertion, can you?
Insertion is
It
action
is.
is the flexion of the forearm. Action.
Okay. And which nerve
Yes, it's
innervates?
a musculocutaneous nerve.
Okay, and origin insertion, you can tell me later. Right,
Okay,
please
ma'am.
tell me. Okay, brachial artery you've identified. If you have to draw the blood from the brachial artery, right, from
Yes.
the median cubital fossa, what are the layers by which this brachial artery is protected from the needle? Or in other
The
words, this needle, yes,
biceps tendon,
and
bicipital aponeurosis.
anything else? Okay. Right, please. Another question. How the elbow joint is formed?
Yes, it's formed by the humeroradial joint, humeroulnar joint, and superior radial ulnar joint.
What type of joint is elbow joint?
It's a hinge variety of the synovial joint.
What are the movements which are possible at elbow joint?
It's flexion, extension, pronation, and supination.
Okay, please tell me what are the humeral attachment of the common flexor and extensor tendons of the forearm? See, humeral
Yes,
attachment, the attachment from the humerus.
yes. Humeral attachment, flexor carpi ulnaris, flexor carpi radialis, flexor digitorum superficialis, flexor digitorum profundus.
Okay, what is annular ligament, please?
Its annular ligaments, attached with the both anteriorly and posteriorly of the radial notch of the ulna.
Okay, please tell me what is the function of anconeus muscle?
Anconeus muscle is the deep muscle of forearm.
Okay, please tell me if ulnar nerve is medial or lateral to the ulnar artery at the wrist.
Yes, ulnar nerve is medial to the ulnar artery.
Okay, and at the wrist, which tendon lies lateral to the medial nerve?
Yes, flexor carpi ulnaris.
Okay, right. Please tell me, if you look at the ulna, so conventionally, which end is termed the head?
Sorry, ma'am.
Ulna, which end of the ulna would you call the
Yeah.
head?
Mom, there is no photo. I think.
Picture. Okay, that's why you can't tell me. I thought you could imagine and tell me. Okay, please tell me, abductor pollicis longus, muscle,
Yes.
its action and its nerve supply.
Abductor pollicis
Longus.
longus. Yes. It's from the lateral boundary of the anatomical snap box.
Okay, but I
And
wanted.
yes,
Yes.
it's nerve supply by the median nerve.
Okay, please tell me, right, ulna and radius both
Yeah.
are united by introitious membrane. So
Yes,
what
ma'am.
is the name given to this type of joint?
Pivot type of the synovial joint.
No, which one?
The
Ulna?
superior and inferior radial nerve joint. Both are the pivot type of the synovial joint.
Yes, but they are attached through introitious membrane.
Interosseous membrane. Yeah.
Yes. So what is the name of for this type of joint?
Syndesmosis.
Yes, syndesmosis. Now you are told me correct.
Yeah.
Please tell me, what are the muscles which causes flexion of the elbow?
Yes. Flexion of the elbow done by the biceps brachii, brachialis, and brachioradialis.
And what are the extensors of the elbow?
Yes, triceps and anconius and triceps.
Okay. Right. Please tell me, okay, what do you understand by the Galeazzi fracture?
Yes, it's a fracture of the distal radius with displacement of the inferior radial nerve joint. Distal
It's
radius
the fracture of the proximal third of the radius with dislocation of the distal radial nerve joint.
Ma'am, Galeazzi fracture may be the lower end.
No, it's the proximal third of the radius. Okay, I want you to tell me. Okay, you were telling me an extensor of the elbow or triceps and anconius as well.
Yeah.
Okay, what type of joint is syndesmosis joint?
Can't say, ma'am.
Okay. What is bursa?
Bursa is a synovial sheath.
It's a fibrous sac lined by
Fibrous,
synovial
yes, fibrous sheath.
membrane.
Yes, yes.
Yes, and it's filled with fluid.
Fluid.
Right. Thank you. In case of patients presenting with rheumatoid arthritis, they have inflammation of this condition. Why? How does the inflammation of the bursa takes place in patients with rheumatoid arthritis, especially around the elbow?
Yes, the posterior aspect of the elbow is subcutaneous tissue and it's may easily distended.
Yes, the answer is because of repetitive movement, inflammatory conditions take place, and that causes the inflammation of the bursa. Okay, good. Thank you.
Thank you, ma'am.